Please come get her.
Alright, we are live on
Wait a minute,
YouTube.
okay, so I don't know.
I'm looking for a screen.
Okay.
So if you want to give me a second, to just tell everybody what we're doing.
Yeah. Oh, okay.
Good evening, everyone, and welcome to our first in-person meeting in a year and a half. Oh, hold on, the YouTube thing is.
YouTube
Give me
on.
a second.
These work? This is a light. Oh, yeah. LED. They're mute.
I turned the volume down. Hold on one second.
Yeah, that's a light, but the mute. Testing 1, 2, 5, 6. I don't know. Now playing center field for the New York Yankees.
Nobody's logged in. Nobody has the Zoom link for me.
How do you create mute?
Push it away from your.
Well, there's nobody. We couldn't either because
A bit more in the room than in the mic.
I left messages
I
for
think
both.
it's a directional mic,
It's a deck, yeah. So I'm used to like mute button.
so you gotta.
Lights up in front of you.
Yeah.
You are being muted.
There we go. That fixed it. Thank you. All right. I will. Thank you so much. If you want to take one and pass those around. All right. Good evening, everyone. Sorry about that. So
Under 4-1.
part two, we'll try again. So welcome to our first meeting. We are streaming to YouTube. The goal here, what the legislature is doing with the equipment that they have here is, since we started this process of making meetings more accessible via YouTube, we really want to keep doing it even as we start coming back together. We have ordered this equipment for the boardroom at the mental health department. So once that technology is there, we'll shift back to the boardroom and having our meetings there and be able to do the same type thing. It's not required of us, just meeting in person is, but since we've kind of created the expectation that folks can watch things virtually, we wanted to continue doing that to make our meetings more accessible. So that's where we are today. Please into your microphone because that helps the equipment pick up what you're saying, but also know if your microphone is right in front of you, it's picking up what you're saying. So if you're having a side conversation, push it away from yourself so it's not being captured. But otherwise, Mary, I'll turn it back over to you and we'll have a meeting as usual.
Okay, thanks. Do we need to say this is live streamed and recorded?
Yes, please.
So that's the usual announcement we've been making. So I'm delighted to be in person. It's been a long year and a half, and this is great that we can do this now. So it's everyone's waving and hugging, and that's great. Good. Well, thanks again. So maybe we should start with introductions just to start things off that way, since we have different names in front of us, especially. So we'll do that. So I'm Mary Hutchins, Chair.
John Lipa.
Paula Winter.
Jackie Wunderlich.
Larry Roberts.
Mandy Coy. Corinne Palazzo.
Sheila McHenry. Elise Schweitzer. Dan Lynch.
Bergman.
Harmony Ayers Friedlander.
Frank Rupa.
Thanks, everyone. So are there any additions to the agenda that you've received? Anything you want added? There's time. Okay. So let's move on to approving the minutes from June. Can I have a motion for that? Jan? And a second, Stu? There. Any discussion about the minutes? Okay, all in favor of approving them? Okay, thank you. Great. Any privilege of the floor? Don't think so. All right, and I have no board correspondence to talk about. Any announcements? All right. So moving on to the chair's report, I have a couple of things to mention. Today, we received a message from Kevin McKenna that he is resigning from the board. He's retiring from the police department and moving on to some other activities. So he let us know that today, and that will include the substance use subcommittee also. So we'll need to have some discussion at some point about recruiting for his position. But I just wanted to appreciate him. He wasn't able to make today's meeting, and I've sent him a note just thanking him for his service. I think it's been helpful to have the perspective of law enforcement on our board. And I think he was mentioning he started serving in 2013, so it's been a long time. So,
Are you planning to ask the law enforcement agencies if they have any interest in putting someone forward?
I think the nominating committee will talk about that. We already have some candidates from our earlier search for openings, so we'll have to take a look at that. I think it's been our sense that it's been helpful to have that perspective on the board. So we'll have to talk about that. But if you all have thoughts about that or want some input on that, you can certainly let Stu know. Stu?
Yeah, I got the email as well, and he indicated that a replacement for law enforcement could be handled directly through the Ithaca IPD chief or the sheriff's department. So he left us, referrals for that, but that is something that we will follow up on, trying to get another law enforcement agent, at least on the substance use committee, if not on the board.
Is there any more input about that, that particular position on the board?
Yeah, I would also agree with Kaki and Stu. I do think we need representation given the police reform, the plan, cahoots, all that. I think law enforcement is going to be really a pivotal player. So I think getting their perspective would be very helpful.
As well as I think them getting our perspective.
Absolutely. Yeah.
It goes both ways as we go through these changes.
Yeah, absolutely.
Paula?
I'm just wondering if perhaps having someone on the substance abuse subcommittee would be more comfortable and they would be more willing to really speak out about views of the police department as opposed to in this setting.
Mm-hmm. Yeah, that makes sense to explore that. Sure.
I don't think Kevin was shy to give his opinion but that's, him. But I understand your point of view on that as well. But again, just echoing, it's important. It's been invaluable information that we've gotten from Kevin, being on the police force, getting, firsthand information, especially when we had not the pandemic, it had its own pandemic.
Opiates and marijuana and.
Yeah, kind of the anecdotal stories that we heard from him directly, to that means also we had the chief of the fire department having his opinion during those years as well. So again, it's important to get police and firemen back on the committee.
Good. So I'm sure we'll hear more from the nominating committee about that and what we'll be doing. Another topic is we've been talking, I think, probably for the last couple of years about the need to revise the bylaws for our group. And some of that has been held up due to the merger and some of the revisions that are happening with the county charter. So some of those steps need to be taken before we can actually tackle a revision of the bylaws. But I was thinking it might be useful for us to get a small group together to at least review the bylaws and get a sense of what areas we would want to look at when the time is right after those other pieces have been finalized. So I would imagine it would be a couple of meetings. So if you all want to be in touch with me, if you want to be involved in that, if you could do that in the next 2 weeks or so, let me know if you want to be part of that, and we can get together once or twice, depending on how long it takes to do a first look at our current bylaws and highlight the areas that we want to delve into further when the time is right. So if you can let me know about that in the next 2 weeks, that'd be great.
Can we get a copy of those bylaws in advance? Just to see, if we're interested in being part of that group.
Karen, could you send everyone a copy of those? That'd be great. Yeah, I think it's been, I don't know, Stu, you were looking at them. I don't know how long it's been since we've last revised them, but yeah, it's been a while and we keep thinking about when's the right time to do that. But I don't know if you want to say anything more about that, Frank, or with the...
Yeah, I think there's parts of the bylaws I think you all are going to want to update that are not merger related, like membership on the board and some of those other things. So certainly those can be tackled now. And I think as you're making progress through that, it'll kind of fall into line with the bylaw changes related to the merger. So I think it's time to get started. And I think those two processes can run in parallel. And then hopefully the bylaws will be ready to go as soon as the charter is amended.
Okay.
And that charter being amended timeline is?
So our hope is that it will be second half of 2022. Right, so the biggest thing that prior to the charter conversations, the main thing in the charter is what the new department is called, the roles of the two boards, particularly in the selection of the DCS and the department head that need to be addressed. And then really just establishing the department. So the charter really is kind of at the end of that identity change / discussion about what the boards and the department head and DCS relationship is for it. So, but before that, we have to combine the chart of accounts budget-wise. And so the planning for that right now is we're hiring some of the fiscal administration positions that are part of the reorganization that we've been talking about. Once those are on board, that will free up some time for Jeremy and Brenda to really dig into what merging the chart of accounts looks like in preparation for that actually happening January 1 of 2023, which is a new budget year. But in order to do that, we have to have it in our budget summer of 2022. So while it seems like it's a long ways away for 2023, it'll really be starting March and April of 2022 that we'll need to have that chart of accounts process underway. So all of those things kind of have to fall in line. But once that's done, we have a subcommittee working right now on a cross-functional team working on the identity question. They will be bringing a plan forward to you all, the Board of Health and the legislature in a couple of months about what that process is going to look like on finding our new identity. And then our hope is that that'll be done sometime in the first half of 2022. So that way the charter conversations can begin in earnest.
Jan?
Can I just ask who is on the identity
Sure, it's actually part of our integration goal in our strategic plan. There's staff from both departments. You would ask me. It's being led by Michelle Hall, who is our WIC director at the health department. And there is representation. I think Karen, you're co-chairing that one. Yep, and so Karen is co-chairing with Michelle. Gail Birnbaum, a nurse at Public Health, Caitlin O'Neill, who's an administrative person at Mental Health. Sue Spicer's on the other one. Jeremy Porter has been participating, myself, Sam Hilson. I'm gonna blank. I will get you all the names. That's what I can.
I
Yeah,
don't need every name. I just wondered in general who was representing.
yeah. It was a volunteer opportunity, so folks got to volunteer themselves. Part of that process is to put a plan in front of you all for your sign off, right? Not at the end where we came up with an identity and said, here, approve this. We want you to approve the process for getting to that identity before we do that process. So you'll be involved, you'll have opportunity to give input to that, both you, the board, and the legislature, because ultimately the legislature has the final say on what the new name is. Yep.
Okay, so if you can let me know in the next couple of weeks, that'd be great. And we'll pull a meeting together sometime to start this process. Couple of other things. During our October 4th meeting, Harmony has invited folks who can give us a presentation on the roles and responsibilities of the Community Services Board. There's individuals from the mental hygiene directors. Is that their name? Okay. Those folks who have done a training on this topic, and given that we're having some turnover and new members, it seemed like a good idea to do a very structured, organized presentation so that we're all starting from the same understanding of why we're here and the history of this. So that'll probably take most of the meeting in October. So that's our plan. And we'll have at least one new member at that point. Suli, I believe, is going forward to the legislature. I'm not sure if that has been finalized, not yet. Okay. And then in our September meeting, I thought it would be useful for us to spend some time reconnecting. We'll have new members again at that meeting, and it's still to be developed, but we'll spend some of our agenda just getting to know each other a little bit better, and maybe spending some time recognizing each other for the work that you've been doing over time. It's been a long year and a half, and I've really appreciated everyone's vigilance in attending meetings and following up with things, even when it hasn't been optimal to get together. So we'll do some kind of celebration as part of that agenda too. So that's pretty much my report. Any questions? All right. Okay. Frank, we could go to your report.
Yeah, and I'm gonna try to do something. I don't know if it's gonna work. Let's see here. Well, that's interesting. Okay. Then I need to scroll down on here. All right, there we go. Okay, so I wanted to talk a little bit about budget this evening. We've already submitted our departmental budgets to the county administrator for her review. That's for those of you that are new, how the process works is we are given what's called a target budget as a department, which includes the amount of county dollars that have been allocated based off of the goal that the legislature has set for a tax levy. And then we build our budget within that target. We have revenues that come from a lot of different places, fees that we collect for services that we provide, state aid, grants, and other sources. The county money is really that unrestricted dollars that we're able to use. And so we're given a target every year. If we want to request funding outside of that target budget, we have to submit what's called an over target request, or OTR. So I'm going to be saying OTR quite a bit. I wanted folks to know what that means. So essentially OTR is just a request for additional county funds above what was allocated in our initial target. Now this year is a little unique. Every year's been unique, but as far as the budget goes, because not only are we dealing with the budget, but we also have the ARP, the American Rescue Plan funds that the county is working on. The budget committee was meeting just before this to talk about what the county's plan is for those funds. So that's kind of complicated some things. So some of what we have here is OTRs. We were really instructed to say, even if we had ideas that would fit into the ARP funds, we should submit them as an OTR. And then as we go through the process, the legislature will kind of decide where those monies might come from. So they're still trying to figure out how to best use those ARP funds and how best to, work the logistics of the budget system. So I'll talk about that as we go through, but I wanted to kind of give you that overview. So we have 4 that we've put forward. There was a 5th one, and I want to talk about that real quickly. So this television equipment that you see here, we are going to put 9 of them in the mental health building. So every space that we have that's a meeting space, so group rooms or meeting rooms, will have the ability to have this technology in place. And the reason for that is, as we're moving forward in this new world, we want to be able to do both in-person and remote services and meetings in every space that we have. So for example, if we have staff that are working from home on a Wednesday, but their team is meeting on Wednesday, some of them may be in the building, some may be in home. So they could go to a meeting room and the remote folks will be on the screen remotely and the in-person folks will be together in the room and still be able to meet together as such. The same thing translates potentially for group sessions. If we have some individuals that can only or need to participate remotely, while others are able to participate in person, all of our group rooms will have this same technology to be able to do that work. So it's really exciting that we're building upon this kind of telehealth system that we've been using for the last year and a half. The reason that's not an OTR is the health department has what's called rollover funds. We've never talked about that at mental health because we've not had any. The reason rollover is created when you underspend your budget on things other than staffing. So if you underspend on staffing, that money just goes back to the county. But if you underspend on other expenses, it goes into your rollover account. And that rollover account the county allows us as departments to come to them and say, I have X amount of rollover. I'd like to spend it on this normally one-time costs because it's one-time money for big projects. So we've been able to use that funding for paperless initiatives. We electrified our fleet at the health department with those funds over the years. Because our budget was in the negative at mental health, we're still roughly in the negative 2.5 million in rollover because of all of the years of negative budgets. We've used to be 3.5, so we're making some progress, but it's going to be a while before mental health will have rollover to spend. The good news is we're going to leverage that public health rollover to buy 13 pieces of these equipment. 9 of them will go in the mental health building. The other 4 will go in the public health building. So we're going to try to do that this calendar year. So that's going through the legislative process now to get approval to spend that funding. So it won't need to come out of the mental health budget or funding. So we're able to leverage that. But that's how we're paying for the equipment that we're going to put in the building and why it's not a OTR, because we're doing rollover this year.
Can you tell people what the overall budget is? I mean, in round numbers.
Sure. That's a good point. Yeah, it's roughly $13 million. Both public health and mental health are each roughly $13 million. So there's a lot of money that comes into the mental health budget that just goes right back out in contracts to our community and state funding. We bring in roughly $3 million in revenue at the clinic through our billing for Medicaid, Medicare, and insurance. So that kind of gives you some of the big numbers. Most of our expenses are staff, right? They're our biggest recurring expense. And they take up the bulk of the budget expenses outside of those contracts that we give to other entities. Once the county budget is kind of put into the budget book, we will get that out to you, the mental health and public health components of that, so you'll be able to see line items that come in front of you. What we're talking about now are OTRs, because what I'm hoping is that I can get your support for these OTRs to be able to when we go through the budget process, say that the Community Services Board supports them. Just to kind of, for the new folks, the process, and maybe a review for all of us, we submitted our budget to the county administrator. I'll be meeting with her, with Harmony and Jeremy and Brenda next week to kind of go through all of that for county administration. Then they take all the department submitted budgets and they turn that into the county administrator's proposed budget. That gets submitted to the legislature beginning of September, and then that becomes the tentative budget for the county. Then from there, the legislature has their meetings where they hear from all the departments about their budgets and the OTR requests that they have. And then at the end of that process, they have what are called voting meetings at the expanded budget committee to add or remove things from the county administrator's proposed budget. Once they're done with that process, then they have a public hearing so the public can weigh in on that. And then they take a final vote, which usually happens sometime in November. So all of the detail stuff you will see when the county administrator publishes the county budget sometime end of August, early September. And then you'll be able to see line item by line item, everything that's in it. Technically, neither board has authority over the budget of the departments, but you certainly are policymakers, and the budget impacts policy, obviously, right? Whatever you're spending money on is what you're actually doing. So we want to make sure you guys have a general understanding. So to your question, Larry, we're continuing everything else that we've been doing. There are no reductions in our budget and staffing. In fact, there's growth in the budget for staffing that will come from it. So all of our programming will continue. It's planned to continue. And you'll actually see in the OTRs that there's some expansion and new ideas that we want to bring to programming. Okay.
Do we have a price tag on the 14 televisions?
Yes. It's roughly 150,000 in there. I can get you an exact number, but it's
rough number is good.
Yeah. So the first thing on here, Jeremy sent me the OTRs in an email. The mental health court one-time salary and fringe money. For those that have been around, you'll remember when we started the Ithaca Wellness and Recovery Court, we agreed to fund a position to support that, but it really should be funded by OCA, the Office of Court Administration, because they are the ones that fund and operate the courts. They have not come up with that money. And so this position we put out as an OTR because we don't want OCA thinking that we can pay for it forever, because we shouldn't be, they should be. So it goes as an OTR, but it is our first priority OTR. That's why it's first on the list. If for some reason the county administrator chose not to fund it, we would have to go back to our budget and find out how to fund it and reduce some other expenditure to cover it, because we prioritize and believe the court is extremely important, as well as the staff. In fact, we actually just increased the salary for the person working in that position based off of the work that she's been doing above and beyond what we originally thought the position was going to be. So just because it's an OTR, it really has to do with the relationship with OCA, not how we prioritize it in the department. It is something that absolutely needs to continue, and we agree with that. The second number up there is related to the mobile crisis team. So we've been having some challenges with the mobile crisis team in staffing because the demand has gone up. It's gone up pretty dramatically from what we originally expected. So we've been working with county administration and the union. We have renegotiated, we're just waiting for signatures on the final paper, the compensation for those that are on call. When we originally set it up, the compensation was mirrored what was happening at the health department for on-call. what we now know is that it really should mirror what's happening at DSS for their on-call, because the type of work that's occurring is more similar. So it's really modeled after that. The staff was a part of those conversations. They support it. They've told the union that. We're really just waiting for the signatures to get on the paper. What you see here is we just didn't have enough money to cover it for 2022. So we had to put a bit of money into an OTR, but we don't know for certain what the total cost of it is going to be, because it really depends on the volume of calls, but we wanted to be realistic and make sure that there was resources available for that. So that is out there as an OTR for recurring costs. County, we have been able to increase the on-call as well as the compensation. So once somebody goes out, they're compensated at 1.5 times their pay. Regardless of whether they're a 35-hour or 40 employee, as soon as they go out on the call, any hours for that, they're compensated at 1.5. So there's an increase there as well. We were able to absorb most all of that, but a little bit of it we were not comfortable we would, so we wanted to put this out here. Plus, it also brings the conversation to the legislature about what we're doing, the increase in demand for the services, and then hopefully that flows right into the public safety reform conversations that are being had. The third one is the big one, which really I'm hoping you'll support all of them, but I wanted to make sure you supported this one. The Alcohol and Drug Council has come to us with an ask for funding to support their operations up on Trip Hammer Road. What they're finding as they start up, as I think we all knew, the state funding is not adequate to support everything that needs to be done. And in startup, it's even harder because you don't go from 0 to fully filled beds, but you need to have the same level of staffing for all of that and bringing things on board. So they've come to the county with a request. The way that we have put it forward is a multi-year one-time request. So target requests are recurring costs that go on, but you can also request one-time funds. And so rather than committing to recurring dollars, because ideally we would want them to be self-sufficient, but we certainly believe that the number that they need this year or next year is not the number they're going to need 4 years from now. So the proposal is a 3-year one-time over target request, $250,000 for the first year, $200,000 for the second year, and $150,000 for the third year. So it reduces by $50,000 each of those 3 years. So that's how we're presenting it to the legislature. It's close to $500,000. It might actually be a $500,000 commitment to the detox center and the work that's going to happen on Trip Hammer Road from the county. The county administrator has been supportive. Whether it comes out of ARP funds or comes out of the budget as fund balance or tax levy, that will all still need to be worked out. But as I said, we were directed to put these all in as OTRs. So this one is new money to a contracted agency. You all obviously have a role in whether or not we support those types of funding. Having met with Angela and the Drug Council folks, we do feel comfortable that they need these monies to kind of get operational, but we also feel like we need to have a short-term plan to see how it all unfolds before there's any long-term commitment of ongoing funding. So for the $250,000 would be for 2022, 2023 would be 200, and 2024 would be 150. So it at least gives the council a commitment over a few years to know that they will have that for operating expenses as they move forward.
Has there been discussion of this in the substance use subcommittee?
There hasn't, and that's because of timing. The Drug Council only brought this to us a few weeks ago, and it had to go through county administration. So unfortunately, it didn't get there before it got here. It was a matter of timing. Certainly there's still time. It can come, we can have Angela come to the substance use subcommittee's next meeting and talk it through to kind of let you all, have a bit more information or detail about it. That's not a problem. And you can certainly put, conditional support if that's what you choose to do, until you have an opportunity to hear more from them about what it is they're looking for.
I think our next meeting is Wednesday. Right, Tom? Huh?
Tomorrow. If you have space on your agenda, I can see if Angela can be there.
Tomorrow?
Tomorrow's Tuesday.
Tomorrow's Tuesday.
Wednesday, right? Wednesday at noon?
I think, yeah, okay.
All right, we'll find out when it is and see if Angela can be there.
All right, that would be helpful.
Does that,
Yeah, no,
Yeah.
for all of us.
yeah, it was a
I
timing
was
thing.
wondering one, but it also seems to me that that's the kind of thing that there should be discussion within the substance use subcommittee.
Yeah.
Who can then make a recommendation to us since they know more about it.
Yeah, no, understood. It really was a timing issue with this. And this is a new ask from the Drug Council, so it was outside of the normal, early year questioning about contracting and the such. Then the next thing up there is peer support specialists. So this is something we're excited about. It's actually connected to the PROS program. So the thought here, the funding that you see there would support 40 hours of peer specialists. Their plan would be to try to hire 2 that would work 20 hours each because they think that model fits better with the folks that they've been talking to about doing this type of work. But we've been very interested in trying to bring peers into the work for quite some time. And so this would be our first kind of real foray into putting some funds to it and seeing if we could get a program operational.
They're gonna be 50% for 20 hours a week. Are they still gonna have benefits?
No, they would not. Part of the issue with the peers, as we understand it, is that many of them do not want to work full-time because of other programming and other things that they have going on and the impact on benefits that they get otherwise. So we could do a 1 person at full-time if we found that worked. What I understand from the program folks is this was based off of the needs of what they believe the peers were looking for. So if there's a difference in that, we can certainly adjust. We would prefer to have full-time people. We always do. This is just what the program folks proposed.
So I'm not wild about this idea. First of all, because I want to know, I'd like for this to come to the mental health subcommittee in June. Yeah, I can try. So I'd like this to come to the July subcommittee meeting to be described more in detail, since the mental health subcommittee hasn't heard about this, because there are models of peer support that are better than other models of peer support. And one of the questions I would have is who supervises these people and what is their role in the context of PROS? I'm not opposed to the idea of peer support specialists operating in the mental health system, obviously, but we need to really know what we're talking about, because there are ethical standards and practical realities about what the role of a peer support specialist should be in the context of a mental health treatment program. I also have questions about where the request came from, since unlike the Jenkins Center and Space before it and the Starlight Club before it, there is no peer support agency in town, although the Mental Health Association makes that claim, and I believe it. So I want to have a much more robust discussion about what this would look like, because there are right ways to do this and definitely wrong ways to do this.
Sure. No, absolutely. And and my apologies that things have not gone through the subcommittees this year. It just this is another thing for the ARP funding that we were originally considering. It wasn't in our initial budget until the conversations around ARP came up. So the timeline on that has been much truncated compared to what we normally have. Yeah, Larry, absolutely. We can bring that conversation to the subcommittee. We, of course, want to do it the right way, and we want to make the best use. It's something that we've talked about with peers, bringing them into we'd love to see them in all of our areas of priority. And we just saw this as an opportunity, and the pros team has been talking about it for some time. So we can bring that forward to you guys so you can talk it through.
Let me, one of the concerns that I have is that PROS is not a peer-run program. There's no way to say that it is, even if the clinicians happen to have personal experience with mental health difficulties. So I'd be interested, just to put this out there, I'd be interested in if we can certify or if MHA can attest, I'd be interested in having a discussion with them about peer support, these positions, because I would feel more comfortable if peers were being supervised by peers. There's a huge discussion historically about the appropriate place and the appropriate supervision of peers, and we can't just throw them into a place without really having that discussion.
All right. Other questions about that one?
I would just add to what Larry was saying. I've been approached about this issue just from an employment law consideration. So I think there's been some concern in the community, the mental health community, that there's potential to sort of create this second-class citizenry of employees with this model if, like you say, Larry, you're not really careful and intentional about it. And I think, it can be done really well, but it can also be done really poorly, and can sometimes result in a group of people with disabilities who have, not the same benefits and privileges of employment as the other employees in the same setting. And that can be a really big problem for lots of reasons.
Yeah, no, we would obviously love to have all of your insight and support in figuring out how to do it most effectively. Okay.
And I just want to piggyback on what Elise said. And I understand, and I've heard it for years, people coming forward and saying that many of the people who may be willing to take these jobs don't want full-time employment because of other benefits. But I think that we have an obligation to be looking at the whole picture and making sure that we aren't, as Elise was saying, creating a second, sort of second-class group of employees, as well as that we're really looking at, what does that mean? That we're changing what we offer people for employment because they can depend on other kinds of public funding, and I've always had some problems.
Well, and the other aspect of that is that that information probably isn't accurate, and those people might benefit from benefits counseling because they probably, should be encouraged.
They know what they've
much.
got,
right?
And they think they need to keep it, and I think that all has to be looked at.
Nope, fair. Absolutely. Great, thank you. The last thing up there is post-COVID clinical trainings. And this was something that Harmony and the team put together, again, for the ARP considerations. It really is a series of trainings that will help us navigate telemedicine, the shift to doing things differently in our clinic. We were forced to do it in March of last year, but now it's our new model, and we can't just expect staff to magically understand how to provide high quality clinical care in this new setting without providing them some resources. So they put together a series of training offerings. The number that's up there is really kind of I don't want to call it a placeholder because we do have a list of trainings that would add up to that, but it really is wanting to prioritize and make sure that we're able to give our staff the training that will be necessary to move forward in this new telemedicine world. So that's what that OTR is from. And again, it more than likely would be an ARP request, but this is the process that we're going through right now.
And who would provide the trainings? Are they done internally or do you have external people doing the trainings?
We're going to have people do it externally. One of the things we're looking at is deciding who should have telehealth services and then how do you best provide it. But we're also looking at other things around what kinds of issues we think people might have after COVID, looking at grief and loss work, improving trauma work. There are a lot of models out there right now about how to create a trauma-sensitive environment, which is not just about the clinical work you get, but the entire environment. And you can go through them for over like a year period of time. And also looking at some work around suicide prevention and treatment, things like that.
So those are the OTRs that will be going forward. Like I said, you'll get more detail about the entire budget once it's published. We generally don't give that out publicly because the county administrator is really the person that develops the preliminary budget. And so not wanting to get out in front of that person putting their budget out. So you will get to see it line item, all of the contract things, but there are no reductions in the budget. There's actually growth in the budget besides these. A couple of things that we're doing. We've had some retirements, so we're able to do some of the fiscal reorganization that we had planned to do. We are at the health department adding a communications person that actually we're interviewing in the next week or two to try to fill that position. So that person will be doing communications and helping get messaging out for the new department combined, which will include mental health. So that's good news that that's happening now. We're reorganizing QAI and health promotions a little bit. We're working on some new job descriptions for some folks that have been performing outside of their current job descriptions. We're going to be shifting some staff. I don't know, Ted Sheely, you all might be familiar with. He's done a lot of work around tobacco prevention in the county. He's going to be spending some time shifting out of tobacco and working with our data folks in QAI to kind of help, kind of bring big picture health outcome data forward and help tell the story about that, similarly to how he did with tobacco. So there's some reorganization that's occurring. We are adding 2 social workers. We've offered and are waiting for acceptance back on those. One is a new position, which is also to help support with the mobile crisis team, they will be a member of the mobile crisis team, but also will help to bring down caseloads a bit. So that way folks serving on the mobile crisis team aren't so overtaxed. And the other one is a repurposing of a nursing position that became vacant. Harmony and Susan Spicer looked at the clinic and made the determination that it made more sense to fill that with a social worker position to provide therapy because our nurses are now more focusing on more direct nursing services. So good news there. We are still recruiting for a medical director. Dr. Lippert is part-time now. He retired at the end of last year and agreed to come back. He is part-time and he's agreed to stay on as long as we need him, but we are actively looking for a full-time psychiatrist to be our medical director. Dr. Miller, Karen Miller, who you all know has been with us for a very long time, is actually now in Texas, but she is providing telehealth services for us. So she has maintained her caseload and is doing that work through telemedicine. For us. We've added a nurse practitioner, Ann Bartone, started this year with us. So we now have 2 full-time nurse practitioners working in the clinic as well. So in the midst of everything that was going on, except for the unfortunate loss of the home home agency, sorry, the rest of the clinic has really been able to do well in this new environment, and we are actually expanding with the expectation that there'll be more demand on our services. So generally speaking, the budget is a lot of good news this year for us. So that's all that I had. I certainly understand wanting to hear more about all of those, and there really isn't a big rush on any of them, so they can obviously go back to the subcommittees for further conversation. I would be interested in at least some discussion or feeling from the board about the Drug Council proposal, because that one it's a large one and it's an outside agency. And so it would be helpful as I go into conversations with the county administrator to get a general feeling of the board on support in theory. It doesn't have to be in principle, in complete support, but if you're generally supportive of us trying to help the Drug Council get off the ground up on Trip Hammer Road, that would be useful to know.
Right now, I feel like all I've ever heard when I came on the board in the midst of time is that we need a detox in Ithaca. I mean, I think we should just name it the Stu Bergman recommendation for the money for this. I can't imagine us. I mean, we have wanted this thing forever. And I think whatever makes sense in terms of supporting it as it gets off the ground. I had a quick question about several months ago, I read that there was some opposition from neighbors and people. Is the council still dealing with that, and what?
I haven't heard. I don't know. I know there were some meetings during the pandemic. To be honest with you, I don't know. I want to say it's okay now, but I will follow up with Angela. Do you know, Stu?
The community had a certain zoning preference when the access was built, and it took a few meetings from the Village of Lansing to have it approved, but my understanding, probably about 3 or 4 months ago, they changed the zoning variance to allow for the access to, there were a few folks in the neighborhood, as you would imagine, that disagreed with the location. I don't see that as an issue at this point in time, since the variance was provided by the village.
And towards the end of it, it wasn't about community opposition. It was a zoning issue. The code enforcement officer made the determination based off of their code that it was most similar to a hospital. And a hospital is not zoned for that area. So the conversation was, can the board override that? Is there a different description of what this is? Because we all know it's not a hospital. It's not going to create the traffic or, the same impact that a hospital would. And that really is where the legal component of it in the definition of what type of facility it was came in. But you're right. Now that I do believe it did get through. The village made a different determination than the code officer, and they did get the zoning approval to go through. But I'll confirm that with Angela and make sure that that's right.
So has the slow start been partly due to COVID? If not, why didn't they anticipate this?
Yeah, I think the short answer is they did anticipate this. I mean, Angela's been having conversations with both the county administrator and myself for a couple of years now that there was an expectation at some point there would be a county ask. They didn't know what it was. And to her credit, she didn't want to come to us until she had a better understanding of what the actual need was. And there's lots of money coming in for the capital side of it. So they should have plenty of funds to be able to do that. Originally, she thought there was going to be some need for capital support, but that worked itself out. And now it's really about the operational. I think some of it has to do with COVID. Some of it also has to do with the state funding that the state is now agreeing to provide. And the regulatory requirements of needing to have all of the staffing there, regardless of how many beds you're using, really puts them in a position where if you're getting paid by patient in a bed, until you have those patients in a bed, you don't have revenue coming in, but you have the expenses of all the staff and other things that are necessary for it. And I think that's really what this bridge is about.
Yeah, so you don't feel like there was any fiscal mismanagement?
No, I don't think so at all. In fact, Angela came with the numbers. She proposed the 250, 200, and 150 over 3 years. My recommendation to the county administrator was that it be one-time funding, so it's not a long-term commitment. Let's see what happens over the 3 years, and then decide at that point because if we're thinking about these as startup funds, startup ends eventually, right? And so what is the true ongoing commitment that's necessary to support the facility? And I think before we commit long-term, we should, give them an opportunity to get that initial boost, and then let's have the conversation about what the long-term commitment will be.
I also think that there was some, talk about patience and waiting for a detox to appear in our community. Appreciate the nod, Larry. But once we found the place and utilized it, had that open access tour to the public, which I think I would recall 2.5 years ago.
Probably.
The amount and the millions of dollars that was promised by the state, it was a snag, call it gently. They promised, I think, $7 to $9 million, and we got the word, but we didn't get the paperwork, and took seemingly another number of months before that. So it's the access center has been very slow in progressing. I think for a while it was just open on weekends, and $250,000 gives it an infusion to make it work better. I'm certainly all for it.
It sounds like you have a lot of support for this.
Great, that's really all we needed. And we'll make sure we get folks to the subcommittees to talk in more detail over the next couple of months about the different things. Obviously, none of this is set in stone until November. So there's still plenty of time to weigh in on any and all of these issues as it unfolds.
Okay. All right. We're a little tight on our agenda. Harmony, do you have a report?
Frank actually covered most of the things.
Okay.
So, no, that's fine. We're good.
Thank you. All right. Going on to subcommittee reports, if we could make them as succinct as possible, that'd be great. Elise or Sheila, do you want to start?
Sure. I chaired that meeting. We met June 8th, and that meeting in June and again in May, Harmony did a lot of work with the describing the status of the local services plan, and the big issue, and that came up with agency updates, is the staffing crisis. So that definitely is going to be a priority for the DD subcommittee going forward. And we're looking at ways to, try to collect data and look at some innovative strategies, bring in the workforce development. So we have I think it's going to provide a plan for how we're going to be using our time in the next year.
Any questions? Okay. Larry?
So the subcommittee in the last 2 meetings has been talking a lot about homelessness and people who are homeless. We had a very good discussion with both Tabby Baker and, now that I've talked to him several times, his name isn't coming to me.
Is it Roy?
Roy Muto from the St. John's Community Service. He gave a very extensive presentation about what the Friendship Center does and what St. John's Community Services does. And we had a good conversation with Kit Kephart, who is the director of the Department of Social Services, Frank's colleague, about ideas that are being discussed among people who think about this stuff on an ongoing basis. So she wasn't very specific about what they were talking about, just that they are talking about the needs and the requirements, both of the agencies and of the people that they serve. A really interesting thing that Tammy Baker brought up probably represents an opportunity for the mental health subcommittee and the substance abuse subcommittee to work together, which is what happens to people who have both substance use issues and mental health issues when they're in crisis and go to the hospital and don't get admitted, and what are the back and forth about that. So that's an issue that we will be addressing. This coming meeting is being developed, meaning that I sent out an email and people responded. So we haven't put it together yet. One of the questions was, Mary suggested that we invite the executive director of Family and Children's to come and speak with us. And so my question is, would it be better to have that person come to this meeting, or shall we invite her to our subcommittee meeting? Anybody really want to meet her who's not, or him or her, them, who's not on the board, on the subcommittee? Okay, so we'll invite her to the subcommittee meeting and you all can come if you want to. That was easy. That was me. Was it under 4 or 5 minutes?
Larry time for sure.
I knew you. Where are we going to meet?
No, I was going to say, when are we going to talk about the peer specialist? I thought that was.
Oh, we should put that on the agenda. Well, yes, thank you for reminding me. And actually, where are we meeting?
On Zoom for the subcommittees until we figure that all out. This board is required, as I understand, to be a public meeting. Subcommittees are not, because they have no decision-making authority. So we're going to continue those on Zoom, at least for the next month or so. And then we'll start working that back as well. Hopefully, once we have the equipment in place, because we really want to continue to engage folks as much as we can outside of the in-person opportunity.
So are we meeting in person tomorrow or on Zoom?
So I'm just about to send an email to everybody and say that Karen will send us one.
Oh, are you planning to meet in person?
That's what I was told.
She told us we were meeting in person.
In person. You have to change it. You can meet in person if you want.
Okay.
No, we prefer Zoom.
We do.
So one of the challenges I was just talking about is I think we need a little bit of transition time, because our calendars are done in advance, and now suddenly realizing, oh, I need travel time between my meetings is a bit of an adjustment, so.
And to get out of your
You are able to meet in Zoom if you so choose to do it that way.
In Zoom.
In Zoom.
So tomorrow is Zoom.
So
Okay, so we've got a plan. All right, Tom, did you want to add on your subcommittee, what's been happening?
Well, whether we meet tomorrow or Wednesday, have to determine that, but we might as well meet on Zoom. It's much more convenient. Well, there's no place to park anyway, so. Anyway, we are pursuing more of the issues of concern, and we've been talking about housing, and we also were talking about enticing people to come into this field. How do you do that? And the fact that the salary people get, in most cases, is not sufficient enough to have decent housing. So the idea came up that if we can hire a person at a certain level and also provide them with some housing. And so people will say, well, okay, well, what kind of housing? Well, there's one guy around, Carmen Guidi, who runs Second Wind, who has a bunch of 14 little houses that he's built. And they're very adequate, very nice. So we're going to have him talk to our group about that concept. He knows a lot about it, and it could be very interesting to offer someone a position with a decent salary and a place to live. Now, if this, this idea gets around, it could be an enticement for more people to come here and want to work in this field. Because I know for a fact, we lack people in this field. I know the enrollment at TC3 in this field is diminished, and that has to end because KSACs like me are aging out. They're leaving the field. We don't have a commensurate number of people coming back into the field. So that was one thing we were going to address. The other thing was the idea came up as to how to entice people to go into the field. Well, my thought was that we have about 10 people on the committee who attend. So I came up with a bunch of questions to ask each one. What was your original intention for coming into the field? How did you get there? What kind of education do you have? Do you like it? Do you plan to continue? And every one of these people would be asked all those questions. We could put information together and we could submit this kind of information to people who we might think are interested in the field and try to, like I said, entice them to come into the field. So see if we can have some things to offer in order to expand our field. And we'll see if it works. I'll keep up with on the report. So.
All right. Thank you very much. All right. I'd like us to go into executive session at this point.
Just real quick before you do that, because we're going to stop the recording. I am actually going to be going on vacation. So I will be out from June 23rd to August 15th. So I'm taking a 3-week chunk off to kind of recharge from all of this. Harmony, of course, will be leaving things in very capable hands, but just wanted you all to be aware that I won't be reachable during that 3-week time frame. So please rely on Harmony for anything that you need.
Have a great time.
Yeah, it's a well-deserved time, Frank. Enjoy. All right, so I'd like us to go into executive session to discuss a contract issue. Can I have a motion to do that? Sheila, in a second with Tom. So all in favor? Okay.
Give me 1 second.
Say what time it is.
6:38 p.m. Okay, cool.